with it as intimately as you are, rarely see persons who do have the disease. And sometimes you get the impression that when you tell us that 160,000 people have died of the disease and that there have been 242,000 cases and et cetera, I think the question has to be, where are these people? I mean, and I think we've had earlier shows to indicate that people sort of withdraw. Now, what are some of the experiences that you've had with this?
One of the things that I've found over the years is very often until someone knows someone or knows someone who knows someone, this disease stays pretty far away. It's only when you become, when someone that you love and care for and know becomes infected that all of a sudden the realities of this disease hit. With hospice care, I watched people and journeyed with people as they died for 10, 15 years. This is the most devastating disease I've ever seen. It's also a disease that is affecting our young people. Our average age is 31. And when you watch someone waste away, it takes a lot out of you. The people are everywhere, but very often the fact that they've had HIV has been hidden. They died of leukemia, they died of cancer, they had a sudden heart attack. They find other reasons, other names to give that disease. And then what happens is for the survivors that are hiding something, that carry a big secret, they have a hard time adjusting and they develop mental health problems very often because of it. It's like you're carrying the biggest secret of your life, and if someone finds out, then they're not going to like you, that you're going to be discriminated against yourself. This one person said to me, I don't have any of the same friends I had when I was diagnosed. All my friends are people that I thought were my friends aren't my friends. And that's tragic to learn, one, you have a disease that's going to kill you, and two, that you really had no friends to begin with. And then most of these people dig very deep inside and come out a little stronger.
Very good. And of course, most of your activity is directed toward trying to deal with that disease in Nashville. Now, you also, I think, published, Ms. Wood, a survey, a guide in terms of AIDS care and et cetera. Why don't you give us some information about how that came about?
Right. At Nashville CARES, we received a grant from ECATEC, the Central AIDS Education and Training Center, and the Community AIDS Partnership to publish, I think it was our 3rd edition of the Community Resource Guide. We did that about a year ago, and for the first time we made it a statewide guide so that anyone that would like that guide can call us at CARES and we'll be glad to mail it to them. Again, that number is 385-1510. It's been really helpful. We use it with our clients. It has information in the back of it about applying for disability, other programs that can be helpful. One of the things we find very often is for our clients, perhaps they started in a socioeconomic middle-class background, and this disease takes one thing after another away, and very often at the end they have nothing left. They have no financial resources. Guide's been real helpful for them to know where to go and access other services. It helps our social workers too to remember all the available resources that we might have.
This is just a devastating story in terms of this disease, and of course Nashville CARES is only one of many organizations in Nashville trying to deal with that. Is there any kind of effort to try to coordinate all of the AIDS efforts? And
there is that effort, and I think we do a pretty good job of that. If we don't have something someone needs, we know where to refer it. We work, our social workers provide the social work at Lentz Public Health Clinic in partnership effort because that's our area of expertise in addition to education. We work with other groups, Project COPE, which is based at Meharry. We sometimes go out on the street and do street outreach with them. We work with the Downtown Service Center and travel on their homeless van, outreach van at least once a month. I think that there is pretty good coordination here. We all talk to one another. We all see each other at the Nashville AIDS Network or the Tennessee AIDS Council. We participate in planning together.
I think one of the things that we noticed quite recently was the new designation by the Centers for Disease Control in Atlanta in terms of AIDS. Now, why don't you give us some information in reference to what that is and how you perceive it, the impact that it will have upon what you do?
The new definition has been really helpful. The CDC debated on that for a couple of years. The big issue is the fact that many of the diagnoses are diagnoses that are related to men and not to our children and to our women, and this disease affects us all. So what happened this in January, they added 4 new definitions, 4 new diseases that would make you have full-blown AIDS. One of the things maybe we need to stop and say is HIV is a continuum of disease. You're diagnosed and you're HIV positive. You might go 3, 5, 7 years with no symptoms. Mid-disease is when you begin to develop some symptoms, night sweats, a little nausea, diarrhea, thrush in your mouth, and you begin to get a little sicker. Full-blown AIDS is when you develop the presence of at least one opportunistic infection. That might be a form of cancer, tuberculosis, pneumonia. There are a lot of diseases that go with that. So they've added 4 more. The big point that they added was chronic pelvic inflammation, I can't say the word today, for our women, which validates that our women, very often, their reproductive system is infected or affected by HIV. The other thing that they added was the fact that if your T-cell count is below 200, that will now qualify you for full-blown AIDS. So what happened on January 1st was that a lot of people woke up in this country doing pretty well, but now have a full-blown AIDS diagnosis because their T-cell count is below 200.
And of course that would also increase the number of persons who will have to now ask for additional aid and assistance in terms of dealing with the disease. And it's almost a vicious cycle in terms of how to deal with it. I mean, what's the ultimate outcome? Certainly you don't know, but speculated on it. What?
The ultimate outcome is if we don't provide good early intervention, our people are going to be sicker and require more and more intensive inpatient care. So what we're trying to do is provide good outpatient care, good case management, good early intervention, trying to get people on good prophylactic drugs, drugs that will keep them from developing those opportunistic infections. Back in the early days, someone might have had 5 or 6 pneumonias. They might have been in the hospital with one treatment after another. And I think we have been really successful in decreasing the hospitalizations per client and providing better, what we call prophylactic care, to keep them healthier. If we don't pay attention to this disease, it has the potential of absolutely bankrupting our healthcare system. So that we all need to be aware of that and support those that are working in this field. I know there's some talk about, well, there's so much money that's given to AIDS research, we're neglecting heart and cancer and da-da-da-da. What we have found is that much of the research with HIV is applicable to the cancer, to chemotherapy, to the other problems, so that they're learning at the same time.
That if you can find a cure